Hey everyone. I just wanted to do a quick check-in. April is also Occupational Therapy Month, and I want to highlight to you the best part that I love about being an occupational therapist is the treating the whole person, holistic realm. I'm not only looking at your physical limitations, I'm looking at what's stopping you mentally, what's stopping you emotionally, what's stopping you psychologically. And I just want to state to all the occupational therapists, all the therapists, thank you for staying in the healthcare profession and know that once a therapist, always a therapist. I'm not active, as in I don't see cases, patients right now, but it never leaves me. When I'm sitting in the car, when I'm watching people, some people may think I'm checking you out because I'm interested. I'm really not. I'm just checking to see what's wrong with you, any abnormalities. I've been trained to see what's wrong with a person, whether their posture, their balance, their coordination, whatever it is, and to fix it. The top three professions that I love working in are is the school system, is the working with specifically people who've had strokes, cerebrovascular accidents, CVAs, and also working in the home care. Because there's nothing like seeing people in their own environment and seeing, actually, just being quite observing, observing, observing how they are in their natural habitat. You get a lot of information just being quiet and watching people. As I learned, I can do that. And I just want the field of therapy to continue to advance, continue to be inclusive with their treatment, and to really heal in all facets as much as you can, because there's still some red tape with the higher ups in healthcare. All right, be blessed. Remember your power. I said April is Occupational Therapy Month. Occupational therapy is the field of science that focuses on rehabilitating, restoring, and assisting individuals with physical, cognitive, developmental, and emotional limitations. Eleanor Clark Slagle is considered to be the mother of occupational therapy. She was actually a social worker that believed meaningful routines and engagement can shape a person's well being. World War One shaped the field of occupational therapy because lots of soldiers were getting injured and they were going through something called
They were
shock
going through
therapy.
shell shock.
And the higher ups wanted help for these soldiers. So OT at that time in the early 1900s consisted of craft work, woodworking, and knitting, different things to engage in fine motor tasks, helping with social engagement to help these soldiers to regain certain functions. After a while, a few years, it evolved into um, instrumental activities of daily living. So it worked on vocational training, training people for jobs. It worked on dressing and cooking and bathing and job performance and different things to help an individual navigate through life. As of current, occupational therapists can be specialists in different fields. They could be hand therapists, and specialists are people who receive more training, education, and hands on experience. And then they take a test to become certified. So, it's hand therapists, lymphedema therapists, vocational therapists. There's people who are trained to work with those who have traumatic brain injuries, pelvic health therapists, pelvic floor therapists, I should say, excuse me, neurodivergent specialists, therapists, and it runs the gamut. So if you need help after injury, after surgery, after a stroke, or uh, knee replacement, occupational therapy can get you on your way to do and be independent in all your activities of daily living.